Hi everyone, this is Dr. Corolla Okogbaa. Coming to you once again with some eye health information. And so one of our questions today is, can smoking really harm my eyes? Can smoking really harm my eyes? And so we all know that smoking can affect our body overall, our overall health. But the question is always, we always tend to think about smoking impacting our lungs. But we know that smoking have an effect on every organ in your body. And so how does it impact your eyes? Okay, so generally, and there's been studies with many different types of eye conditions that have been shown to have when smoking is there when somebody smokes, these conditions actually get worse. And with some conditions that you have with the eyes, some of the recommended treatment to reduce the progression of these eye diseases is to actually quit smoking. So yes, smoking can have a significant impact on the eyes. Okay, and so one of the common ones, let's talk about dry eyes. Okay, so dry eyes when the eye doesn't make enough tears, or it's not making enough quality tears to keep the eyes lubricated. The smoke the constant irritation from the smoke can really cause that to worsen. Some people can have that scratchy feeling all the time, that chronic redness, constant red eyes from smoking. That can definitely worsen that dry eyes. Okay, there's another one, cataracts. We know cataracts is a age-related process, right? However, there are certain things you could do to make that process accelerate or go faster or get cataracts sooner than you should, and that's from smoking. That's one of the things that can really increase the development of cataracts. All right, one of the other conditions that we'll be talking a lot about this month is called age-related macular degeneration, where it's a condition where the central vision or the center vision gets damaged. And so smoking is a huge risk factor for developing age-related macular degeneration. And one of the part of the treatment plan is, if you're a smoker, is to quit to help keep the eyes, to help you keep the vision and to keep the eyes from developing into blindness, really. And so the next condition, again, common condition, diabetes. Okay, so if you're diabetic and you smoke on top of that, well, guess what it does to the eyes? It increases your risk of developing diabetic eye disease, macular edema, diabetic retinopathy, those type of things that we don't want to see in your eyes if you are diabetic. But if you smoke, it increases your risk significantly. Okay, glaucoma or other optic nerve issues, smoking have been shown to increase or worsen these type of eye situation or eye conditions as well. And there's one that maybe some may have heard of, Graves' disease, right? It has to do with your thyroid, high thyroid, hyperthyroidism. And when you have Graves' disease, in many people, you can develop the what we call bulging eyes, where the eyes are very, very prominent because that condition is impacting the eyes. While smoking tend to worsen that. It increases your risk of having those bulgy eyes and all the other consequences of having that type of eyes. And of course, the best thing to do if you are a smoker is, my recommendation, like all your physicians would say, is to quit smoking, get help from your primary care doctor or other programs to increase your overall health and to increase your the betterment of your eye health. Okay, and so yes, smoking can have a negative impact on your eyesight and your overall eye health. And so very important to take care of that. If you smoke or if you know someone who smokes, please send them this video and remind them to check in with their eyes, get their eyes checked, let them see their primary care physician as well for their overall health, and maybe get some help to quit smoking, okay? So this has been your Eye Health Minute. So if you happen to be in the Baton Rouge area, come on in. We'd be happy to help you get your eyes checked and work with you to help you keep those wonderful eyes working as well as they could. All right. Have a blessed day. Bye-bye.